So welcome everybody to the first Smoakland CBD workshop. A show of hands, who has heard of CBD? Okay. And aside from your lovely samples, who has tried a CBD product before in the past? Maybe quite a few of you. And who has tried cannabis at any point in their life? Okay, we have a pretty educated audience here. So you may ask, how can CBD make my life better? And what do I have to do to try CBD? And we're going to answer those questions and many more in this next hour. And we'll have time at the end for a Q&A if you have any questions. So here we have a panel where we can refer to psychology, mental health, and addiction. We have a pharmaceutical industry representative and a patient point of view. And we also have a chiropractic and therapeutic approach with CBD use. And I'm a cannabis consultant. I help entrepreneurs and existing cannabis businesses be in compliance with California state regulations. So I educate business people about cannabis policy, but my passion is really educating the public about the therapeutic qualities of cannabis medicine. In 2010, that's where my cannabis story starts. I was invited to work on a farm in Santa Cruz, and that's where I started interacting with cannabis from seed to sale, as they say. So I've worked on several farms, and I've also worked in the harvesting of cannabis and turning it into medicine such as tinctures, topicals, cooking with food, and other different ways to work with cannabis. So I'm very honored to moderate this event and welcome these panelists who are here to share their expertise. And the great thing about them is that they're all very accessible to you. They're here in the East Bay and they're here in your community. So I'd like to introduce Dr. Danielle McLean da Silva, who offers massage and chiropractic treatment, specializing in prenatal and postnatal care. Dr. Danielle combines her chiropractic treatment with her unique soft tissue and cranial sacral work for lasting results. We also have Jourdan Jade, who is a professional pharmaceutical representative. She sells THC products to oncologists. And she is a professional expert in synthetic CBD products for various conditions. And at the end, we have Dr. Ron Perry, who is a licensed psychologist and certified counselor. He and his team of mental health professionals provide therapy, counseling, and psychological services for individuals, groups, couples, and families throughout the East Bay. So I'm actually going to start with you, Danielle, if you want to give kind of your background into how your medical treatment intersects with CBD.
All right. Hi there. All right. So I own the Bay Chiropractic and Massage. I'm just a half a block around the corner here. You can't hear me? Can you hear me? Okay. And an office on Piedmont Avenue. And I come from, as a chiropractor, a chiropractic philosophy, we heal from the inside out. And so when I have patients coming to me day in, day out saying I have headaches and migraines and aches and pains and I'm not sleeping, I'm looking for other ways that can help assist in these issues. And instead of having them go to the medical doctor and they're saying, you know, take this medication for that, this for that, what I have noticed in my practice is recommending CBD oil. I've noticed incredible results with my patients in just a small amount of time. So it's been a really great way to incorporate my philosophy of chiropractic, and it just is really congruent with where I come from in healing from the inside out. So that's been really cool to not have to send them out to get a bunch of medications and to have something as natural as a plant. So that's been really cool. So, yeah.
And Jourdan, do you want to give us a brief kind of description of how CBD came into your life and intersects with your profession?
Hey guys, I'm Jourdan Jade. You know me from the lotion samples. So I work as a pharmaceutical sales rep selling dronabinol, which is lab-made THC, to oncologists. So oncologists use cannabis as an antiemetic, which means anti-nausea and vomiting. So when they're cancer patients are undergoing chemotherapy and they have these side effects, if they don't recommend medical marijuana, which is what I more so recommend, then they'll use an FDA-approved THC product. So I do sell that. I'm also a sales rep for a CBD company. Obviously, you guys know that by now. But I'm also a CBD patient. So I use it myself. I have anxiety, insomnia, a bunch of other mental health issues, which he'll get into, which CBD has worked for me. And I'm a big advocate because, in contrast, if you aren't taking a natural therapy, what Western medicine suggests and what doctors suggest is that you take a pharmaceutical product, you take a pill, you take something that's synthesized, that's lab made. And the downside of that is there's so many side effects with it. Yeah, it's made in a lab, but they come with so many fillers and other additives and other chemicals. They all have side effects. So I'm very big on natural alternative therapies as opposed to taking something that's unnatural in your body and it's going to have side effects. I'll delve into this more, but I mean, it's natural. Your body naturally makes these compounds. You have an endocannabinoid system, so this is just supplementing a natural system in your body, as opposed to taking something that's foreign and that's going to confuse your body and not be a holistic approach. I'll touch more on that in a minute.
Hi, I'm Ron Perry. Can you guys hear me okay? Nope? Okay, I'll try to speak a little louder or put it closer to me. I am a clinical psychologist. I also am a professor at Golden Gate University and JFK University. The last 12 years, I've been really specializing in treatment of what we call co-occurring disorders. And what that means is people who come in with simultaneous addiction or some kind of substance use disorder together with some other sort of mental health condition. And in particular, for the last 12 years, I've really focused heavily on working with opioid dependence. And with opioids in particular, what we see is that people who have a history of trauma, whether that's psychological trauma, physical trauma, often it's a combination of both, naturally gravitate towards opioids. It alleviates physical pain, but it also, ends up numbing a lot of their emotional and psychological pain. And essentially what you have is a pattern where someone has turned to a drug or a medication, and a lot of times these
At the advice of their doctor,
exactly,
medical professional who they deem as all-knowing, that if your doctor tells you something, you take their advice, right?
That's it, exactly. That's right. So, sure, there are some people that may initially look for some of these medications illicitly, but actually a lot of the people that I've worked with, started out by getting medications legitimately through a prescription from a physician. And of course, it does help to take their pain away. And then, often as a added effect to that, it alleviates much of their emotional or psychological suffering initially, right? And then in the long run, what happens is that it creates dependence, it creates withdrawal, and it creates a whole other range of problems. This is often,
Big side effect.
Yeah. No, that's right. And this is true also with a lot of the other medications that are prescribed for treatment of anxiety, for example, right? People are prescribed what's called benzodiazepines. These are drugs like Ativan, Xanax, Valium, and it absolutely helps to eliminate much of their anxiety at first, but eventually it creates often more problems than it solves. And so these are a lot of the struggles that I've been trying to help people with. CBD is something that I've been especially interested in the last couple of years as a way to address some of these problems without creating more problems. And that's basically where myself and my team are coming from in recommending CBD.
So a question for the audience. How many of you have heard of the endocannabinoid system? Just a few. So let's talk a little bit more about the endocannabinoid system, because part of cannabis education is building awareness of the human body. One more question. How many of you are on 2 or more prescription drugs? Okay. So let's talk a little bit about the endocannabinoid system. And who would like to start? Jourdan? Okay.
Well, I mean, a big thing is, you know, there's such a stigma against cannabis because it's a drug, it's illegal, but way back 1900s, there was shops, medicine shops that sold just cannabis and hemp oil, and it was widely used and widely accepted. And then FDA, the government came in and made it illegal, but it's a plant. This comes from a plant, just like anything else. Aloe vera, any type of plant you use, it's natural. So as opposed to seeing it as something that's a drug, that's illicit, what helps people be more accepting of it is when they realize our bodies have an endocannabinoid system. So our bodies actually produce endocannabinoids, endogenous cannabinoids. When you take CBD or THC from a plant, those are phytocannabinoids. So you're supplementing a process that's already natural to your body. Our bodies have CB1 and CB2 receptors all over, mostly primarily in the brain, but also in other organs. So the primary role in your body of this endocannabinoid system is to create homeostasis. So when you're supplementing with cannabis, you're just helping your body get back to that homeostasis level that it should be at, which for all of us, don't feel bad if you have stress, if you have pain, if you have whatever ailment that you have to take a medication for. It's not something to be shamed about. In our world, there's so many factors and things that we're thrown with that, of course, your body's going to be out of whack and out of homeostasis. So CBD has many applications to many ailments, but also just anyone that's out of whack, which is pretty normal in our society in 2018.
Yeah, that was great explanation there. Good job. Just a couple of other things might say about the endocannabinoid system. So yeah, as Jourdan was saying, this is our own internal cannabinoid system, right? Endo is short for endogenous, meaning, you know, within the body. It really wasn't discovered until fairly recently, early 90s essentially, is when the endocannabinoid system was first discovered by scientists, and then shortly after they discovered the first endocannabinoid, your body's own natural cannabis-like chemical, right? They named it anandamide. And so essentially what happens is that the compounds in cannabis act similarly to your body's own natural endocannabinoids, like anandamide. But each of these compounds do some different things. Jourdan talked about the different types of receptors in the body. I don't want to get too technical here and make people's eyes gloss over, but basically we have these two different types of receptors throughout the body, throughout the nervous system, the brain and the rest of the nervous system. They're labeled CB1 and CB2. CBD, it does interact with both types of receptors, but it seems to interact more from a lot of the research that's out there with the CB2 receptors, whereas THC is thought to interact more with the CB1. And CB2 receptors are actually found a lot more throughout the body, throughout what's called the peripheral nervous system, outside of the brain, right? And so that's where a lot of the anti-inflammatory effects, the interaction with the immune system, a lot of that's happening with those CB2 receptors. I think that's probably about as much science as I want to throw out there right now, but okay.
Do you want to add on to that? Should we go over, do you guys, is everyone fairly clear on what CBD is, cannabidiol? So there's so many components in cannabis. You can pull out a lot of different molecules, but CBD is the second largest in weight. So THC is largest in volume. CBD is second. However, CBD does not get you high. So it's not psychoactive. THC is psychoactive, so that's why it's labeled a drug and put into a scheduled class, but CBD is not. So it's kind of just the therapeutic use. Just want to make sure we're all level set on that.
So Danielle, can you tell us how you use CBD in your therapeutic practices?
Yeah, so what I noticed, I kind of mentioned that a little earlier, was that I get a lot of patients when I'm doing a history intake, and just with stress in our environment, just more and more, I'm finding patients who come in and they're anxious, they're stressed, they're having difficulty sleeping, they're having discomfort, headaches and migraines, and I'm just seeing this more and more patient to patient. And I see really great results with the chiropractic adjustment, but sometimes you need a little something more. And so as I started recommending CBD to my patients, I mean, just the results have been pretty incredible. So one pretty notable, I had a patient who has, sorry, can you still not hear me? Okay. So I had one patient who has debilitating headaches, and she said she's tried everything. She gets some relief from the chiropractic adjustment, because when we have misalignments in the upper cervical spine, we can have disruption to the brain, and that can cause headaches. It's one of the main causes of headaches. So a lot of times I adjust and we get some relief, but not always. So with this patient, we adjust, she gets better, but it's still there, and she comes in quite often. And she was one of the first patients that I recommended some CBD oil to. And with her, what she's noticed is, so she uses it preventatively, and she'll just kind of rub a little bit of the topical cream on her temples every day. And when she does get a slight headache, she uses a little stronger tincture that she uses sublingually. And she usually, she says that it doesn't last very long, and like it's hard for her to keep track of how often, but it's decreased dramatically, and the duration of the headaches. So I found that case in particular was pretty cool, because she would go weeks with day in, day out with headaches, and all of a sudden she's using this proactively and not getting these headaches anymore. So that's been really cool. I also had a patient, she's in her mid-60s, she's an avid runner, she loves to climb, and she came in and she's went through a bout of depression because she's unable to do her activities because of arthritis and really bad joint pain in her knees. And just went through this months of depression, and so I recommended some CBD cream. She started lathering it on her knees, and she came back to me and she was just so excited. And just to watch her go from the sessions that I've seen her, and all of a sudden she has her energy back, and she's so excited and so enthusiastic again. And it's really cool to see patients respond so positively. And I would say that was one of the coolest things, because watching her from beginning to end of that, and just the relief that patients are getting from this natural product has been really cool.
So as you can see, there's a lot of different applications for CBD. And we're not talking about getting high or changing your consciousness. We're talking about treating depression, treating anxiety, treating body pain, treating internal pain such as inflammation. And so I want to start to get you guys thinking about the questions that you'd like to ask. Question? So do you guys have any comments on that?
You said you'd like to know more about the food products. Do you mean edibles, or what do you mean by that? With it can be infused into anything. That's the awesome thing about CBD. It comes in so many different modalities. So obviously you guys all got a little sample of the cream. That's good for a localized pain. So you could also get it in a sublingual tincture, which is supposedly the most bioavailable way to take CBD, because you apply it sublingually, you let it kind of soak under your tongue. There's a bunch of very small blood vessels, so it gets very easily absorbed directly in your bloodstream. Whereas if you take it in a capsule form, you have to wait for it to digest and get through your GI, and then it gets in your blood. So you'll get CBD, but it's just a matter of the bioavailability and what your specific ailment is, what you're looking for. Does that answer your question?
I'm also a fan of the. I am a fan of the chocolate, I have to admit. So
That's edible versions are good too. It's all on personal preference and what the condition that you're looking to cure is, and the conditions are so varied. Like I said, I'm personally a patient. I take it for stress, anxiety, insomnia, but I also like I said, I sell THC to oncologists as an antiemetic. So they use cannabis as an antiemetic, which means anti-nausea and vomiting for cancer patients. That's actually an FDA-approved reason. CBD, they're still going through clinical trials, but CBD is next to be FDA-approved for a multitude of reasons. Obviously, the first would be what?
I would imagine that it's going to be probably for treatment of anxiety disorders at some point soon. That's at least speaking from the mental health side of things. But before that, I would also guess just as an anti-inflammatory.
Anti-inflammatory for seizures. I don't know if any of you guys have heard or seen, there's a video that went viral and this kind of made CBD big. There was Jaden's juice, where they had children who are having seizures, and they took a little tincture, which is what we have, tinctures of CBD oil, and just instantaneously their seizures stopped, where they would be on all these anti-seizure medications that didn't work, had a plethora of side effects. To have a side effect, you have to take another pharmaceutical for a side effect. I'm sorry, but the unfortunate part of Western medicine is we don't treat the cure. We put a Band-Aid on. We say, hey, we're going to prescribe you this to cover the symptom, but not really get to the underlying issue at hand. And that's where Western medicine and doctors, nothing against medical doctors, but they've kind of failed us because they don't look at the real underlying cure and take a holistic approach to healthcare and realize you can't just take a pill for this one organ. Your whole body is related and it's all holistic. And that's why I'm an advocate for CBD, because as opposed to taking these, human-made, lab-made chemicals that even if you take a pill, and there's nothing wrong with pills. Some people do need them, but there's also fillers that go into it. There's extra additives that go into it. There's all unnecessary things that are foreign to your body that's just unnatural. So that's why just, a natural plant-based made therapy would obviously be a better choice for your body and in the long run.
Yeah, also just to clarify the point earlier about FDA approval, it was recently approved, is my understanding, for seizure disorders, particularly 2 forms of severe epilepsy that occur in young children. That's probably going to be the next kind of the next big wave of FDA-approved use of CBD. But there is a plethora of research, of studies out there showing efficacy for anxiety, for pain, anti-inflammatory, anti-anxiety, antipsychotic. There are actually a lot of studies out there now that show that you can actually get equal results with CBD that you would get with antipsychotic medications, but without all of the horrible side effects that antipsychotic medications have with them. Keep in mind that's one of the main reasons that a lot of people who need antipsychotic medications don't take them, the compliance issues. It's because of the side effects. And we're seeing in the research that CBD can be just as effective, but without all of those side effects. So I think that's going to be another wave as well. Mm-hmm. Yes. Is that, sorry.
The effects it might have on Parkinson's?
Parkinson's? Yeah. So, do you want to speak on that? All I can say is I've read a lot of research that CBD is great at neuroprotective effects. I just read a bunch of articles on stroke. I know you said cardiovascular, so I'm just going to go on before I go on a tangent about heart health.
Yeah, so actually, that kind of piggybacks on what I was talking about with the antipsychotics, because the movement disorders that a lot of the antipsychotic medications tend to produce, CBD actually protects against. And that seems to be true with conditions like Parkinson's disease, and also perhaps there's some protective factors there with Alzheimer's as well. The recent research that I've seen seems to suggest more of a protective factor with Parkinson's rather than treatment. So it means that there. And we're still researching this. It's not a known at this point. But what the evidence seems to be suggesting from the articles I've read is that if someone may be predisposed to Parkinson's, or if maybe there's a very early onset of symptoms, it may be possible that CBD will help to prevent the disease from progressing. Once the disease has progressed, it doesn't seem that it's reversible with CBD. That's basically the evidence that I've seen. Yeah, and so, again, it's very early stages of research from what I've seen on that. Definitely, it seems that CBD may be very helpful in treatment of movement disorders in general, right? But I think the verdict is probably still out in terms of being able specifically to treat the symptoms of Parkinson's once it has progressed to a more advanced stage. Does that make sense? Yeah, okay.
Another question? So his question, and you said you were a dentist, is why some people hesitate to use CBD as a treatment for different ailments. So I guess in general, because the federal government has maintained that CBD is, as part of the cannabis plant, is a Schedule I drug. So on the federal level, it's illegal to use it. What the state of California has done by legalizing cannabis is that it's vouching for cannabis businesses and saying that we know our cannabis businesses will be in compliance with our state regulations, and so we'll allow this to operate in the state of California. So I'm not a medical professional, but CBD does not seem to have any side effects at all.
That's the magic of it.
That's well, that's an excellent question, and it's one that everybody is asking around the world because so his question was, if there's no side effects, then why has the government been so hesitant to recognize it as a medicine? And part of the prohibition that has existed for almost 100 years is because the government decided it had no medical value. And, there's been clinical trials and research done around the world proving the opposite, but a lot of these clinical trials have not been replicated. Or they don't have enough of a sample group to definitively prove that it has no side effects and it has a medical value. That's changing very, very quickly. Almost every day, new clinical trials are being embarked upon. I have a mentor who works at UCSF, and he is finishing up a survey of CBD, asking patients how they use it and how it's been successful for them, and so those results will come out in December. So little by little, the research is being proven. but it's up to the researchers and the clinicians to embark on those studies. And as you can see, because the laws are changing in every state very quickly, the research is overwhelming. And then there's research done in Spain, there's research done in Israel, and all over the world, you know, the writing is on the wall that CBD is a good, you know, alternative to other medications. And it's become apparent that the cannabis plant, which has these two main molecules, THC and CBD, has medicinal value. Both of those molecules and the whole cannabis plant has medicinal value. It's the same plant, yeah. Yeah, it's one plant with different molecules. And you can't demonize a plant just because you don't like one part of it. You can't say, oh, that mango tree is illegal because I don't like the mango leaves. No, the whole plant is medicinal. The whole plant is valuable. And it's actually also being recognized as an industrial resource too, because hemp is also a cannabis plant. There's different versions of it, but the cannabis plant is almost overwhelmingly being proven to have medicinal value. You're welcome. Do we have any other questions? Any topics that you're interested in, you want a little more info on? Oh, sure. So, and the lovely lady over here asked about olive oil and cooking with cannabis. As somebody who has just experimented with that, kind of a DIY at-home cannabis maker, I will take cannabis flowers. You can saute them. You can put them in, for example, I put them in hemp milk. And I did like a double boiler so that the hemp milk had the cannabis molecules in it. And because I'm doing this at home, I'm not able to separate THC from CBD. But, you know, cannabis is a plant that is accessible now in the state of California, and you can experiment with at home. On the market, there is a variety of different cannabis products. Some are topical, some are sublingual, some are edible in terms of a pill or a food. And I think the infused, what they're calling infused products, which might be a soft drink or a cooking oil, that's still kind of a gray area, because right now CBD products and hemp products are under scrutiny for not being allowed unless you are a cannabis business. So there's some hemp products that are being sold for pets. And the government, the Department of Public Health in California has said the only people that can make those products, whether it's for humans or animals, they have to be cannabis licensed manufacturers. So it's kind of a gray area. There's a lot of products. We don't know which ones are going to stand the test of the regulations. But you could experiment at home and try your hand at cooking with cannabis. There's cookbooks out. There's definitely YouTube videos and ways that you can start to interact with the plant, in addition to going to trusted vendors and licensed companies for their products, which they've already tested, and they can give you really accurate percentages of the compounds. You want to add anything?
I just wanted to expand on your question of why is CBD not used more or promoted more or more widely accepted. The unfortunate truth with Western medicine's approach to healthcare and our government is this country is run on profit. So healthcare is run on profit. Hospitals aren't in business unless they make money. Pharmaceutical companies aren't in business unless they make money off people. So it's not really profitable for them for people to be healthy. They make money on people being sick and putting you on this medication, and then you need another medication, and then you have side effects, so you need this medication to cover up that medication, and you just keep compounding, and they keep making more and more money. Oh, and by the way, you need these for the rest of your life. Right. So the unfortunate truth is the government regulates a lot of what is allowed. So why would they allow something that you could take that would allow you to go off all these other medications. Just the same reason why they might not say, hey, you should just go on this fast and all plant-based foods and change your whole diet. They'll say, no, we'll put you on this medication real quick fix, Band-Aid, instead of really taking a holistic approach to what could really heal you naturally, because it's not profitable. So it's unfortunate, but it's just the reality. And that's why we're here to, condone you guys to just take approach in control of your own health care in these more holistic, natural ways, instead of listening to doctors, which, like I said, nothing wrong with medical doctors. They're very knowledgeable, but they're knowledgeable in what medications to use to Band-Aid and fix symptoms instead of the real underlying issue, and just look at something singularly instead of a whole body holistic approach and using Mother Nature, it's called Mother, to fix these things. So that's all I want to add on that.
Any other questions? So we have a little more time for questions or any topics that you guys wanted us to expand on. I wanted to mention that building your own awareness is really important to interacting with cannabis. Unfortunately, the research doesn't exist to say exactly what strains of cannabis or what cannabis products are going to be a good fit for you as an individual. Everybody's body chemistry is different, and so it's going to react with different medicines in a different way. So somebody who's very sensitive might use a topical cream and feel a little bit high and a little bit out of place. Whereas people who have a higher tolerance for cannabis might need a different method of taking the medicine. So can I see by a show of hands, has anybody ever tried consuming a cannabis product before? And you can just shout it out. What kind of cannabis product did you consume? Gummies? Vapes? Popcorn? Brownies? And were these products that you bought or products that somebody made? Homemade, huh? Well, that's the great thing about being in California, is the accessibility that we've had for a long time to cannabis. First as a medicine and now in a more recreational area. So are there any products that you guys are curious about? I wanted to mention earlier that the different ways of ingestion can be drastically different. She mentioned the tinctures, which are fast-acting, and she mentioned the word bioavailable. That means how much of it your body can absorb. So if you're taking a tincture, the bioavailability is high because it gets into your bloodstream quickly. If you're eating a homemade brownie that you don't really know what the percentage of THC or CBD is, and maybe you eat like a whole brownie, that's not going to affect you for a while, and you don't know how potent it's going to be. Right? So there's a little bit of body awareness and experimentation that's going on right now, and has been going on because we just don't have that clinical research yet. Does anybody want to add? What are some of the your clients' preferences in the CBD products?
Well, so far I really started with a salve. And especially because I've got a lot of patients with arthritis and inflammation and, sports injuries that they just need something topical to put on. So I started there. I recently added a tincture, which has also been, seen really great results with that as well. But mostly been experimenting and just kind of seeing how my patients respond to the topical creams. Yeah.
Like she said, there's a lot of different modalities. There's a cream topical, which is good for a localized area. You could take a sublingual tincture. You could take a capsule. It all depends on what your ailment is, what your main goal is. CBD is also not CBD the same with every company. It's an extraction process. So this is a flower. It's grown cannabis. You can grow it with either high THC levels or high CBD levels. That's what the different strains are. So if you have something that's high THC, that's, by the way, these components, yeah, you can synthesize them and separate them, but this is a plant. It is a holistic, so they do work better in synergy with each other. So, like she said, you know, it's all what you're comfortable with, but just keep that in mind. You got to just know your own body, and instead of listening to whoever telling what you to do, just take that holistic approach and listen to your own body. And the one thing that I also want to add, because I was a dietitian before this job, is the holistic approach. It's not just taking CBD to mask a symptom like Western medicine has taught us to do. Take something, a quick fix. This isn't just a quick fix. This is a holistic approach. So I'd also recommend, if you're going to be taking CBD, also eat healthy. Do what you need to do. Sleep well. Take stress reducing techniques. Take the holistic approach to whatever your main goal and ailment is, instead of just, oh, I'm taking this for a quick fix. That's not really the goal.
Yeah, absolutely. You know, just to kind of add to what Jourdan just said, we were talking earlier about the endocannabinoid system, your body's own internal system, right? And your body's own internal chemicals that act in the same way. I just want to emphasize that what this system seems to really do is help to regulate a lot of the various, you know, physiological mechanisms in our body, things like sleep, mood, inflammation, immune response, right? And so when you're taking something like CBD, it's not like taking a pain pill or a Tylenol that just masks the symptoms for a little while until the drug wears off. The idea here is you're taking something that helps to re-regulate something that has been dysregulated in the body, if that makes sense, right? So it's not just to mask the symptom, it's actually to put things back in normal order. It gets that mechanism sort of kicking into gear. And that seems to be true with you know, various different types of syndromes and symptoms that we use CBD to treat. As far as the individual products go, I can actually speak for myself. I'll share with you guys that I myself use CBD. I have chronic back pain and some joint problems. Given that I'm in a business where I'm treating people for addiction, the last thing I want to do is take some pain pills and go and, you know, see a client who I'm treating for addiction to pain pills. And even taking things like ibuprofen or Tylenol, which I've done, but even those over-the-counter medications have some side effects for me that CBD doesn't have. CBD works for me. I feel much better on it, and it's without any noticeable side effects whatsoever. The nice thing about it, too, is that it's not the sort of thing where I just have to take a regular dose, and then if I miss a dose, my symptoms come right back, right? It really does seem to help the body to reestablish what we call homeostasis, right? That sort of healthy baseline of when things are working the way they're supposed to be working. And so, you know, I might take it for a while and then not take it for several days, and I'll be fine, you know, because it really seems to be just bringing things back to normal function. Yeah.
And my only point on the CBD is not all companies are the same. This is taken from a plant, so there's extraction processes. There's different ways to extract it. There's different pressures, solutions that are used in it. So if you try one CBD company and you don't have that much relief, you may have a different experience with a different CBD company or product or modality. If you took it in an oil, that might not be the same type of effect as if you take an edible. So you just really have to experiment with your body, get in tune with your body, and notice the effects. And like I said, this isn't a prescription pharmaceutical chemical where it's going to be an immediate effect because it's blocking some system or pathway in your brain or your organs. It's supplementing naturally occurring processes in your body. No, CBD does not come up in a drug test. THC does. So the one caveat to that is many CBD products are high CBD and a little bit of THC. So you just got to double check on that. You might have a full spectrum where there is, and it's very low. It's like 0.03% THC. But if you had a drug test the next day, you could possibly fail it. Just like if you eat poppy seeds, you could come up for opium the next day. You know, that type of thing. But they do have CBD only products that have 0 THC. And CBD does not come up as THC in a drug test. Did you want to add to that?
Yeah, no, that's exactly right. Keep in mind that there are over 400 identified compounds in the cannabis plant, right? Over 100 of those have been found to have, you know, some sort of active property that they interact with those receptors in the body. THC is just one, and THC is the one that is primarily associated with the intoxicating effects of cannabis. But even then, you have to have above a certain threshold of THC to feel those intoxicating effects. And a lot of the medicinal products that are out there, for example, when CBD is combined with a very small amount of THC, the idea behind it is that you're getting the medical benefits from both, but it's not enough THC that you're going to really, you know, feel high from it. It's not like that. That said, if you really want to completely steer clear of anything that could in any way be intoxicating, CBD alone, you would, you know, it has no effect whatsoever in terms of any noticeable psychoactive change, nothing. And you can get a product that's just pure CBD. That's what I use myself. And, you know, it won't show up on any test, and you won't be altered in any way whatsoever.
One note on dosages, since we're talking about, and since you had a question on edibles, people with edibles and beverages, there tends to be a very low amount of CBD, like 10, 20 milligrams, which isn't really a therapeutic dose. And I think that's a common misconception because someone will take a CBD drink. There's something that has 10 milligrams and they're like, oh, it didn't work for me. Well, no, it probably did work for you. You just need 3-4 times more than what you're taking. So that's a pretty common misconception that, you know, an average healthy person that's feeling fine, no ailments, 25, 30 might affect them. But if you have a condition, if you have something specific, you need at least 40, 50 minimum or more than that. Would you agree? Absolutely. Okay. Anything on it?
So some of the themes that have come out of this panel are holistic lifestyle, maintaining an active lifestyle. You don't want something that is affecting you at your job or at home. And I want to just make the point clear that CBD is a very subtle element. When you're taking CBD products, you're absolutely not going to feel high. You're not going to get that psychoactive consciousness-changing effects that you'll get from THC. I would say that CBD gives me a very subtle feeling of wellness. So if I have menstrual cramps or if I have a headache, CBD is just a very subtle way to treat those things. And so I myself also use it, and I would recommend it to people with different ailments. But again, making sure that you're talking to your doctor if you're taking other medications. And because we're in California, you can openly talk to your physician about using CBD products, which I encourage you to do. But also build that awareness of your own body and what you hope to achieve with CBD products. Do we have any other questions? Huh? Oh, no. There's no recorded overdoses of CBD. Yeah. Or any cannabis compound for that matter. If somebody takes too much CBD products, yeah, they may feel a little frazzled, but it doesn't last very long. And if somebody takes too much of a THC product, they can take CBD to bring them down. It's amazing, yeah. So CBD is a great product that I think you should research on your own. talk to our panelists after we're finished. Ask about some of the products that you see over here. And talk to your family and your friends about it too, because everybody seems to be very interested in being well. And we all want to find ways to help ourselves and our family cope with certain issues, whether it's mental health issues, body issues. And CBD is something that I would recommend to a lot of people to try to address some of those ailments. We have any more comments?
The caveat you did mention, talk to your doctor about CBD. So I talk to doctors all day about this. That's my job. Not all doctors are on board because they weren't taught this in medical school. Just like doctors were not taught nutrition in medical school. They got about a week out of all their years of schooling, correct me if I'm wrong, about nutrition, which is pretty vital part of health, right? So if you talk to doctors and they say, oh, I don't recommend medical marijuana, I don't recommend CBD, you might get that. That doesn't mean it's wrong for you. That just means they weren't taught that in medical school years ago and they don't know. So if you do get flack for CBD or cannabis, don't feel bad. Just you got to do what's right for you. CBD. I think they're probably referring to THC, which there's. Repeat the question. So she said, so when you go to dispensaries, there's different types of strains, especially of THC for if you want to be up, if you want to be down, if you want to be creative, if you want to be on the couch. And that's more depending on the weed strain. So that's an indica versus a sativa. And you can grow many varieties of THC flower. CBD is a little different because this is non-psychoactive. So when you grow CBD, you can't really change the therapeutic components. Yeah, exactly. What makes it different is the modality, how you intake it. So are you using a cream? Are you taking a capsule? Are you taking a tincture? Are you eating it in an edible? That's what will make it different to you. And then also, like I said, in the company, how they've extracted it, what forms they've used to increase or decrease the bioavailability.
So definitely research the products that you're interested in. Because when you go to a dispensary, they definitely don't know about you, and they don't know about your medical history or what your goals are. So you have to add that additional... and make sure that you're getting what you want, because they may just recommend something to you to move on to the next customer. So also choose your dispensary very carefully. Choose your medicine manufacturers very carefully. Visit their websites. The indica and sativa binary is a little bit tricky right now because cannabis has been hybridized for so many years. Since about the 70s, the California convergence was a boom of hybridization where people were mixing different kinds of cannabis strains. They were mixing cannabis, indica and sativa, and then further hybridizing that hybrid. So I don't know if indica and sativa is the best measure of how a product will make you feel. You're safer looking at the percentage, the potency of THC and CBD. So we mentioned earlier that some products have a little bit of THC. So right now on the market, there's a soft gel tab that has 18-to-1 CBD to THC. So that means there's way more CBD in that product than there is THC, which may be good for you. But maybe you want a little bit of THC. And that's something called the entourage effect, which we can talk about a little bit. Does anybody want to talk about the entourage effect?
We touched on it briefly earlier. It's synergistic. So just like our approach, it's holistic. You can't just separate one part. Just in Western medicine, they want to treat just one organ or just your heart. Your heart is connected to all the blood vessels in your body. It's all connected. It's all holistic. So to isolate just one part, yeah, that'll work. But it's the holistic, everything works together.
Yeah, absolutely. So this idea of, when they talk about the entourage effect, scientists in Israel, actually in recent years, have identified this where, and again, I don't want to get too heady into the science, but basically when we were talking about our own endocannabinoid system, the idea that these scientists identified and have studied is that the combination of all of the compounds in the plant seems to most accurately mirror what our own endocannabinoids do, right? The way our internal system is wired to work in response to our own natural chemicals that are produced by our own bodies. And so that's the idea behind it, is that you could get benefits from just taking CBD. You could get benefits from just taking THC for certain conditions. But the theory behind this entourage effect is that when you take the entire set of ingredients that exists naturally in the plant, that's where you are going to get the basically the strongest medicinal effect and the most wide-ranging effect. It's also my understanding, and you guys can probably speak to this more than I can, that from that idea comes what they call full-spectrum products. But you can still get CBD tinctures, for example, that are full spectrum but without THC, right? So it has a lot of the other compounds that are found in cannabis, but it doesn't have THC. And you probably know better than I do about that.
So in these tinctures specifically, these are full spectrum. So that means there's THC and CBD, but it's 0.03% THC. So that's very, very low. But we also have completely zero THC if you needed to take a drug test the next day. Take those ones.
One note I wanted to mention, THC is not bad, but some people aren't ready for that. We have long-standing belief systems in our different cultures and in this country that say changing your consciousness is bad. And it might be a little bit too much for some people. And so that's why we are talking about CBD today, to kind of destigmatize cannabis and also let you know that there is part of cannabis medicine that can be effective. It's subtle, it's not habit forming, and it's very accessible to you. What was the question? So industrial hemp has a very low CBD and THC percentage. There are some hemp plants, or there are some specific CBD strains that will have higher levels of CBD and lower levels of THC. And those can be bred exclusively for their CBD flowers. So the hemp plant, while it can still be very nutritious, like hemp seeds are very nutritious, it's an agricultural, industrial crop, you aren't really going to get high levels of either one of the compounds, THC and CBD. But actually, consuming hemp oil has a lot of health benefits, and eating hemp seeds have a lot of health benefits. So to differentiate between hemp oil, which sometimes is called CBD oil, and actual CBD products, the potency is probably the biggest difference.
The only thing I wanted to add on, because you said THC and the mind-altering, get you high effects, and there's such a stigma behind it. And that's, because it plays on certain neuroreceptors in the brain. So if people are scared of that, I just wonder about this question. Do you think coffee changes your outlook? Do you think chocolate is mind-altering in some type of way? sugar is mind altering in some type of way. All of these substances have certain components that play on your brain activity and receptors and change the way you think and view and what excites you and what downs you. THC, cannabis, is the same type of way. It's a plant, it's a natural substance that's changing your mind. So don't be afraid of it. You probably have other mind altering things all day that you didn't even realize. So it's not scary, I promise.
Do we have any other questions? I think we have time for one, maybe two more quick questions.
I have a question.
Okay.
Quick question for the audience of those who did sample the lotion. Do you feel the effects? Any relief for those who had pain and put a sample on? Do you feel a little relief or no? Yes? Okay. We got, so it works. Okay.
Well, thank you so much for your attention, everybody. It was a pleasure to interact with you and educate you and let you know a little bit more about CBD. And I just want to leave you with one last lesson is how do you want to interact with cannabis? I would like you to think about that because it's, for better or for worse, prohibition is over and cannabis is back in mainstream society. And so do your research. Ask yourself what your goals are and how you want to interact with it in terms of a medicine. Because from these three advocates, from myself and Smoakland, we all want to bring cannabis education to the public and help you find what works for you. So thank you so much for your time.
Another round of applause for this expert panel. Thank you so much for coming together on such short notice. The paper that we've sent around is for a quick survey that we will send out, as well as Dr. Perry has a great PowerPoint presentation that cites a lot of the studies that he's mentioned during his talk. We can certainly forward those PowerPoints to you if you put your email down. Thank you again for coming and attending this first of 3 workshop series. The second one is themed CBD and pain management. It will be the 3rd Saturday of September, September 22nd, here in the afternoon. In addition, our 3rd CBD and aging, or CBD and seniors, will focus on ailments that come with age, the aches and pains and all that. That will be on October 20th, the 3rd Saturday of October, again, afternoon time, 2 to 4 p.m. here at Canberra Restaurant. Please look for us. Please share the word. We really want to educate and get the word out and demystify and clarify this wonderful molecule. And it's simply a molecule. We do offer our word to our sponsor, Smoakland Delivery, Smoakland Distribution, Smoakland Media, and Smoakland Holdings is a new cannabis company. They are coming down the line with full spectrum CBD products. Currently, if you need medical attention and medical products with medical marijuana, and if you do have a recommendation, we have a sister entity called Cannabis Care Collective that offers a collective membership for people until the end of this year. Smoakland will be coming online at the end of this year and especially in January with a huge assortment of products that are full spectrum, THC based as well as hemp based. But for now, if you would like some medical relief, please come up and we can certainly provide you the information to get in touch. Cannabis Care Collective. And if you come up to the table and introduce yourselves and feel free, I won't bite. I can certainly walk you through and show you some of the products that are available in the market, some of the questions about what is thin and full spectrum CBD, why there are numbers and ratios on many of these products. These are all very much stuff that comes with getting familiar with this category of products. So again, thank you so much for coming. Look forward to seeing you again. Thank you. Smoakland Media, you will be able to find this video and audio on smoakland.com and Smoakland TV on YouTube. And so we will be able to upload this and you will be able to share it with your friends as well. Thank you for coming again.